Hey everyone, welcome back to our channel. This is Dr. Alfred Egedovo again on behalf of GHC Hospital, sponsor of this health promotion and preventive care. Today we're diving into a topic that affects millions of lives but often gets overshadowed, lung cancer screening. So grab your coffee and let's get into it. Lung cancer remains one of the most common and deadly cancers worldwide, with smoking being the leading cause of this disease. The United States Preventive Services Task Force, USPSTF, recently updated their recommendations for lung cancer screening in adults aged 55-74 who have a significant smoking history. These guidelines aim to provide a streamlined approach to screening for individuals who are at the highest risk of developing lung cancer. The USPSTF recommends annual screening using low-dose computed tomography (LDCT) for individuals aged 55-74 who have a 30-pack-year smoking history and currently smoke or have quit smoking within the last 15 years. This means that individuals who smoked 1 pack of cigarettes a day for 30 years, 2 packs a day for 15 years, or any combination that adds up to 30 pack years are eligible for screening. The rationale behind this recommendation is that LDCT has been shown to reduce mortality from lung cancer by detecting tumors at an earlier and more treatable stage. Did you know that lung cancer is the leading cause of cancer deaths worldwide? It's a staggering statistic, and yet many people are unaware of the screening options available to them. But here's the kicker. Are these screenings actually saving lives, or are they just adding to the anxiety of patients? Let's break it down. The most common screening method is a low-dose CT scan, which can detect lung cancer earlier than traditional X-rays. But here's where it gets controversial. Some studies suggest that while early detection can lead to better outcomes, it can also result in false positives. Imagine the stress of thinking you might have cancer only to find out it was a false alarm. How do we balance the benefits and the risks? Furthermore, the USPSTF specifies that screening should only be conducted in healthcare settings with expertise in early lung cancer diagnosis and treatment. This recommendation is based on evidence that shows that centers with experience in managing lung nodules and early-stage lung cancer are better equipped to provide appropriate follow-up care and treatment. By ensuring that screening is performed in specialized healthcare settings, individuals are more likely to receive high-quality care and achieve better outcomes. And speaking of risks, there's a growing debate about who should be screened. The U.S. Preventive Services Task Force recommends yearly screenings for high-risk individuals, those aged 50 to 80 who have a significant smoking history. But what about non-smokers? Should they be screened too? Some experts argue that lung cancer is becoming more common in non-smokers, especially women. So, where do we draw the line? On the other hand, the USPSTF strongly recommends against screening for lung cancer with LDCT in all other adults, regardless of age, smoking history, or risk factors. The limitations of the evidence for screening in these populations include a lack of demonstrated benefit and potential harm from false positive results leading to unnecessary tests and procedures. Therefore, the USPSTF advocates for targeted screening in high-risk populations to maximize the benefits of screening while minimizing harms. Additionally, the USPSTF recommends against the use of chest X-ray with or without sputum cytology for lung cancer screening. These methods have been shown to be less effective than LDCT in detecting lung cancer at an early stage, leading to missed opportunities for early intervention and treatment. LDCT is the preferred screening modality due to its higher sensitivity in detecting small nodules and early-stage tumors, which can significantly improve survival rates for individuals with lung cancer. Now let's talk trends. With advancements in technology, we're seeing new methods of screening and even blood tests that could potentially identify lung cancer earlier. But are these methods reliable? And how accessible are they for everyone? It raises a critical question. Is the healthcare system doing enough to ensure that everyone, regardless of their background, has access to these life-saving screenings? In conclusion, the recent recommendations for lung cancer screening in adults aged 55-74 with a significant smoking history provide a comprehensive approach to identifying individuals at the highest risk of developing lung cancer. By focusing on annual screening using LDCT in specialized healthcare settings, the USPSTF aims to improve outcomes for individuals with lung cancer while minimizing potential harms. It is important for healthcare providers and patients to adhere to these guidelines to ensure that screening is conducted effectively and efficiently, ultimately leading to earlier detection and treatment of lung cancer. So, what do you think? Should lung cancer screening be more widespread? Are the benefits worth the potential anxiety? Drop your thoughts in the comments below. And if you found this video insightful, don't forget to like, subscribe, and hit that notification bell for more content. Until next time, stay informed and take care of your lungs.